Most men after 60 ask me one simple question: Doctor, is masturbation still safe at my age, or can it actually harm my prostate and heart? The truth is, it can be both healthy and risky, depending on how you do it. Today, I'll explain exactly how to masturbate safely after 60, what mistakes to avoid, and when you should see a doctor immediately. After 60, a man's body doesn't work exactly the same as it did at 30 or 40. Hormone levels, especially testosterone, start to decline. Blood vessels become less elastic, which affects circulation. The prostate may increase in size and become more sensitive. Because of these changes, even something natural and healthy like masturbation can feel different. Some men notice weaker erections, less sensitivity, longer recovery after orgasm, or even discomfort they never had before. Others worry, could this hurt my prostate? Could this put stress on my heart? Here's the truth. Masturbation itself is not dangerous. In fact, it can support men's health in many ways. But, and this is key, after 60 your body requires more attention. What used to be automatic now needs a smarter, safer approach. And in this video, I'll show you exactly how to do it right, when it's safe, what benefits it gives, and also the warning signs that mean you should see a doctor. When men ask me if masturbation after 60 is safe, I always remind them it's not only safe, it can actually be beneficial when done correctly. Let's break this down. You see, after 60, the body doesn't function exactly the way it used to. Blood circulation slows down, blood vessels lose elasticity, and the prostate often becomes more sensitive or enlarged. That's why regular sexual activity, even masturbation, plays an important role. An orgasm is, in many ways, like a natural workout for your blood vessels. It improves circulation in the pelvic area and helps maintain stronger erections. But the benefits go beyond the physical. After orgasm, the stress hormone cortisol dropped sharply, while endorphins and oxytocin, your body's natural feel-good chemicals, are released. This means many men feel calmer, less anxious, and often notice better sleep when they keep a healthy sexual routine. There's also the prostate. Research shows that regular ejaculation helps to clear fluids from the prostate, which may reduce discomfort and lower the risk of inflammation. And then there's confidence. Staying sexually active after 60, even if it's just with yourself, helps preserve self-esteem, a sense of vitality, and a reminder that intimacy has no expiration date. So, if you ask me as a doctor, safe masturbation in your 60s and beyond is not a bad habit. It's part of normal men's health. The key is to listen to your body and approach it wisely. Now let's get very practical. Masturbation after 60 can be perfectly safe, but how you approach it makes a real difference. The first thing I tell my patients is, take your time. At this age, arousal and erection usually don't come as quickly as they did when you were 30 or 40. That doesn't mean something is wrong, it's simply how the body changes. So don't rush. Give yourself time to relax, to get in the mood, and allow the body to respond naturally. Think of it less like a race and more like a slow, steady routine for your health. Second, lubrication. This is something many men overlook. As we age, the skin tends to be drier and more sensitive. Without lubrication, friction can cause irritation, micro tears, or even pain. A good, water-based lubricant reduces all of that. It makes the experience smoother, safer, and far more comfortable. If you've never used one, after 60, it can be a game changer. Third, gentleness. Some men try to use the same intensity, the same firm grip they used in their 20s. But the tissues are more delicate now. Too much pressure can actually decrease sensitivity over time or even cause minor injuries. A lighter, more mindful touch is healthier and usually more pleasurable too. Fourth, listen to your body's signals. This is very important. If you notice chest tightness, dizziness, or shortness of breath, stop immediately. Masturbation should leave you feeling relaxed and satisfied, not exhausted or unwell. Especially if you already have heart disease or high blood pressure, you must be careful not to overexert yourself. And lastly, treat it as part of self-care, not something to be ashamed of or rush through. Set a calm environment, take a comfortable position, breathe deeply, and let it be a moment where you take care of both your body and your mind. When done with patience and awareness, masturbation after 60 is not only safe, it becomes one of the simplest ways to support your health, your confidence, and your overall well-being. Of course, as a urologist, I also need to be very clear, masturbation after 60 is not always risk-free. There are certain warning signs you should never ignore. If you ever experience pain during or after masturbation, whether it's in the penis, the testicles, the prostate area, or even the lower back, that's not normal. Occasional mild discomfort can happen, but repeated pain is always a red flag. Another sign is blood in the semen or in the urine after ejaculation. That may point to an infection, an enlarged prostate, or in rare cases, something more serious that needs immediate attention. Also pay attention if you feel extreme fatigue, dizziness, or chest discomfort afterward. Remember, orgasm is a physical event. The heart rate and blood pressure rise, and if the cardiovascular system is already under stress, this can uncover hidden problems. If masturbation leaves you more exhausted than relaxed, that's your body telling you something isn't right. Then there are changes in sexual function. If erections are consistently getting weaker, shorter, or you're unable to maintain them, it may not simply be aging. It can be an early sign of vascular disease, diabetes, or prostate issues. And finally, watch your urination. If you notice increasing difficulty starting the flow, a weak stream, or frequent nighttime trips to the bathroom, and at the same time sexual activity becomes uncomfortable, your prostate may be the cause. These are not symptoms to ignore. They're your body's way of asking for medical attention. Safe masturbation should never cause pain, bleeding, or serious fatigue. If it does, it's time to see a doctor. Now, let's be very specific about when you should not wait and instead go directly to your doctor. If you experience pain that keeps coming back, whether it's in the penis, testicles, or pelvic area, that is not something to ignore. Occasional sensitivity is normal, but persistent or sharp pain is always a signal. If you notice blood in your semen or urine, even just once, that requires medical evaluation. In many cases, it may be a simple infection, but it can also point to prostate or urinary tract conditions that need treatment. If your erections have suddenly changed, for example, you can't get or keep one at all, or if they have become dramatically weaker, that's another red flag. Erectile problems are often the first sign of cardiovascular disease, diabetes, or hormonal imbalance. If you already know you have an enlarged prostate or problems with urination, such as waking up several times at night, straining to start the flow, or feeling you can't fully empty the bladder, masturbation that becomes painful or difficult may mean the condition is progressing. And of course, if you have heart disease, high blood pressure, or diabetes, and you feel chest tightness, dizziness, or shortness of breath during or after orgasm, that is not normal. You should stop immediately and schedule a medical checkup. As a doctor, I always remind men, masturbation is not dangerous by itself. But when your body starts sending unusual signals, pain, blood, sudden changes, or heart symptoms, that is the time to come see us. The earlier we investigate, the easier it is to treat. So here's the bottom line. Masturbation after 60 is not only safe. In many cases, it's actually healthy. It helps circulation, reduces stress, supports the prostate, and keeps sexual confidence alive. But, and this is important, the way you approach it matters. Take your time. Use lubrication. Be gentle. Listen to your energy. Make it part of your wellness routine, not something rushed or hidden. And just as important, always respect the warning signs. Pain, blood, sudden changes in erection, or heart-related symptoms are not things to brush off. If you notice them, that's the time to see a doctor. Remember, sexual health is part of overall health. Taking care of it after 60 is just as important as exercise, nutrition, and sleep. Intimacy has no age limit, and neither does self-care. So don't be afraid of the subject. Talk openly with your doctor, listen to your body, and treat your sexuality as an essential part of your well-being. If you found this helpful, don't stop here. Men's health after 60 is a journey, and knowledge is the strongest tool you can have. So subscribe to this channel for more clear, evidence-based advice without myths or shame. Share this video with a friend, a brother, or anyone who might need to hear it. And if you have questions, drop them in the comments. I do read them, and many of my videos come directly from what men like you ask me. Take care of your body, take care of your health, and remember, your sexual well-being is just as important as your heart, your mind, and your strength. I'm here to guide you through it. See you in the next video.